Well, welcome everybody. We're so glad you're here. I am Karen Winkowski. I'm Administrator for Harford County Office on Aging. And today we are here to talk about a subject that will become very near and dear to our heart in less than a month as we roll into the annual enrollment period for Medicare Part D. Harford Memorial, we're getting a lot of noise from over there. Are you guys okay? Is there a way I don't know if we can turn that volume down. All right, good. Thank you. All right, so today we're going to be talking about a basic overview of some Medicare information, and then we're going to really focus on primarily Part D with a little information on supplemental plans, and well, actually Advantage plans. And our presenters today are Kirsten Robb McGrath, and Kristen is with us 2 days a week at the Office on Aging doing lots of things, including state health insurance program information, and helping people navigate Medicare. She works on a bunch of other programs as well, but she actually is employed by the Center for Independent Living, the Image Center, but we're super happy that she's with us 2 days a week and very glad she's here today to present. Emily Bowers-Kogut, who is with our outreach team, and she's going to be talking a little bit about preventing fraud in Medicare when we get to that point in the presentation. Again, if you have a question, we're going to restate your question so that our videographer can pick that up as we go through. And just as a matter of housekeeping, the restroom is through that door or through the back door, around the corner. I'm sorry, Tim, I just hit your mic. And through the double doors on the left side of the hallway, just around the corner. So without further ado, because we have a lot to cover today, I'm going to hand it over to Kirsten, and she's going to begin the presentation. So thank you all for coming.
Hi everybody, I'm Kirsten, and like Karen said, I work at the office 2 days a week doing mostly Medicare enrollment and then information, and then I do a couple other programs for them as well. So today we're going to talk about the beast that is Medicare. So here are some general facts about Medicare. Open enrollment for 2018 is October 15th to December 7th. Individuals can go on to the plan finder and look at their plan details for their prescription plan or their Advantage plan and look to see if there are any changes. Any changes that are made during that time, though, won't be effective until January 1st. Like I said, they can change their prescription plan or change their Advantage plan. They can switch from an Advantage plan to original Medicare, or they can change between Advantage plans. The web address for Medicare is www.medicare.gov. Be sure when you're using the internet to be careful. If you just type in Medicare Plan Finder, a lot of other sites will come up before Medicare's actual site. So we're going to show you what it looks like later today. So just make sure you're looking at the right site before you're putting any of your clients' information in or anything like that. Right now, the Plan Finder is only showing 2017 information. So if you were to go in today or tomorrow to try and look at plans for 2018, they're not going to be available until October 15th. And that day, they will be up and running. So we always advise people to start looking then at new plans or different plans. Okay, so another important thing to know about new beneficiaries to Medicare, they have a 7-month window to enroll, 3 months before their 65th birthday, the month of their 65th birthday, and 3 months after their 65th birthday to enroll into Medicare, A and B and D, without any penalties. Outside of that 7-month window, they are subjected to penalties for both Part B and Part D. If an individual is retiring or leaving a job, I'm sorry, I can say next slide so people know. Next slide. If people are retiring or leaving their jobs, we always recommend, a lot of times people will call us before they've even told their HR that they're leaving or they're planning to leave. We always advise that they speak with Human Resources first to find out what kind of benefits they can receive as retirees. after they've met with them and if they've decided to leave, they'll have 63 days to sign up for Medicare A and B and D and supplemental. Supplemental is optional. We'll talk about that more later. The 63 days that they have to sign up is their guaranteed issue right. That is like special terminology saying that they have a special period to enroll without any penalizations. So there's a glossary on the almost last slide. I think it's the third to last slide in your packet. And if a beneficiary enrolls in a prescription drug plan through Medicare Part D or an Advantage plan, they will automatically lose their retirement benefit coverage. So it's important that they make sure that they're not accidentally disenrolling themselves from a plan that could possibly be better or serve them with more coverage. Okay, next slide, if individuals receive Social Security disability income for 2 years, they'll be automatically enrolled into Medicare by Social Security. A lot of times people will just receive their card in the mail. And then another note we wanted to talk about that's a little bit different than the disability piece of this is that right now, or coming up, the open enrollment season for both Medicare and Maryland Health Connection overlap. So a lot of people get confused. They might see commercials for Maryland Health Connection or the Marketplace and say like, oh, am I supposed to do something? They don't. If they're a Medicare recipient, they don't need to do anything related to the Maryland Health Exchange or the Marketplace. Our open enrollment, like I said before, is October 15th to December 7th. Maryland Health Connection or the Marketplace open enrollment is November 1st to December 15th. The difference between the two programs is Maryland Health Connection is for coverage for families, adults under 65, and children that are uninsured or underinsured. All right, now we're moving on to the overview of the parts of Medicare. So, there are different parts of Medicare. I've been using this to kind of explain to people the differences because supplementals are labeled in letters also, but parts is Medicare, plan is supplemental usually. But sometimes people use those words interchangeably. So Part A is hospital insurance. It covers inpatient hospital, inpatient skilled nursing facility, home health care, and hospice care. Part B is medical insurance. This is your doctor visits, durable medical equipment, home health care, x-ray, lab services, and outpatient services. And then Part D is prescription coverage. These are run by private companies, but they are meeting the Medicare standard, and they're contracted with Medicare to provide the prescription piece. And then Part C is the Medicare Advantage. This is a plan that bundles Part B, and Part D together. It's run by private companies also. They're an alternative to, as you can see on the left-hand side, it's labeled Original Medicare. So it's an alternative to Original Medicare. They're similar to an HMO, so a lot of times if people are going with the Advantage plan, they're going to see in-network doctors under that plan. So for example, we're here today at Upper Chesapeake University of Maryland Health Advantage has an Advantage plan. They would see the doctors under University of Maryland's plan. Their pharmacy would be contracted with them too. So the only difference between the two is that with an Advantage plan, you cannot pick up a supplemental insurance plan. So you cannot pick up a plan to help with the extra costs that are incurred during your care. And then supplemental. Supplemental is for Original Medicare recipients, and it's to cover the 20% that Medicare doesn't cover. Oops, clicked the wrong thing, sorry. I'm sorry, also, I'm a little bit sick today, so if I have to grab a throat lozenge or drink some water, I apologize. I pressed something and now it doesn't want to work for me. Okay, sorry. All right, so like I said, when you first go to Medicare, you have the option to do Original Medicare, where you'll need to get Part A, Part B, Part D, and then optionally you can pick up a supplemental. Or you can do the Medicare Advantage plan. It's one plan and it covers your A, B, and D. So this just goes like a little bit more into detail. I don't need to just read right off of it, but just know that, so actually a couple of things that I will highlight. For Original Medicare, the person most likely will have a premium for their Part B, their Part D, and their supplemental, depending on their income. So they'll have 3 premiums under Original Medicare, possibly. With the Medicare Advantage plan, they will most likely still be paying their the Part B premium, which right now is roughly around $134. Some people have a lower premium amount, again, depending on income. But there are also additional premiums embedded in the Medicare Advantage plan. So they may pay the $134 and then pay $65, depending on what the Advantage plan is asking for their premium. Do you want to, Jan? Jan has a question.
No, it's not a question.
Oh, comment.
Add that a lot of times the clients won't know necessarily, they don't remember that they're paying the Part B premium because it's taken directly out of their Social Security check. So they don't see, they're not paying it, for the most part.
For people who couldn't hear that, I'm going to be repeating questions and comments. So Jan was just saying that a lot of times people don't realize that they're paying their Part B premium because it is coming directly out of their Social Security check. Now, someone who's not taking their Social Security, Medicare will bill them for the premium. So for someone who's maybe not taking their Social Security, it might be more, they may be more aware about paying their premiums, but most of the time it's taken out of a person's Social Security check. Thank you, good point.
So if a person is still working at 65, Medicare becomes their primary, and then if their company offers an insurance, is that a secondary, or how does that work?
So the question was, if a person is working at 65, does Medicare become the primary insurance, and does their group coverage then become secondary, or how does that work? So it depends on the size of the company. If it's over, I think if it's over 20 employees, then the group coverage is primary, and Medicare is secondary until they retire, and then it switches. If it's under that, then Medicare would be the primary, and their group plan would be secondary. Also a great question. We have another one.
Doesn't it sometimes depend on the illness, because with end-stage renal disease,
Yes.
your private insurance, actually you have to keep it for 33 months before you can use Medicare as primary.
That's news to me. I didn't know that. So thank you for that information. She said that if you have end-stage renal disease, you have to keep your primary or group insurance for 33 months before you can use Medicare.
You can use your Medicare, but you can't use it as a primary.
Oh, you can use your Medicare, but you can't use it as a primary.
33 months is up. But that's only if you're still working or you have private insurance through your company.
Gotcha. So that's for people with end-stage renal disease who are still working and have insurance through their employer. Yes.
Hi, can I
Hi.
just clarify? So if you are 65 and
Mhm.
working, your insurance, your employer has insurance. Do you have to apply for Medicare? Not until you retire, or?
Not until if your employer. Sorry. If your employer is over 20 people, then you can just.
You don't have to apply for Medicare.
I don't think.
Can I add to that?
Yeah.
Don't confuse
Sorry,
A and B, because if you working, when you turn 65, you're automatically going to get your Part A because you paid into the system. If you paid into Medicare, you'll get that automatically. Part B is voluntary. And so if you have an employer coverage that's equitable to the Part B, you're going to keep that. And you don't, and then you are, you can delay getting the Part B and you won't get a penalty.
Won't get a penalty?
Not if you have equitable coverage through your employer.
So the question I have about the A then, if you go into the hospital, you present your insurance, but also you would also be covered under Medicare if you're over 65. So they are your secondary insurance?
While you're working, yeah.
Oh,
Okay, so for those of you that aren't in the room that couldn't hear, or for the recording later, the question was, when you are 65 and working and you have employer coverage, do you need to sign up for Medicare? And so Jan said that A is automatically going to be sent to you once you turn 65. You're really deferring B, the medical coverage, which you can do if you have credible coverage through your employee with 20 or more employees. And then when you're retiring, then you'll go to them and basically you just show that you've had coverage. The HR can give you something that shows that you've been covered up until this point, and then you can get Part B with no penalties.
Yeah, I just wanted to add something.
Okay.
One of the things we struggle with as we created this presentation is it could have been 8 hours long because there are a lot of exceptions to the rules. So these are good things to bring up. But one of the things I would always suggest, if you think you come across one of those rocky situations and you're not sure, it's always better to call and check. 1-800-MEDICARE is a great resource. I would say you can check with us, but I know we're going to be super duper busy. So, but even the person you're working with can call 1-800-MEDICARE and check on that. It's better to check and be sure than risk that you have the wrong information, because if you gamble and it's not the right information, we were talking about penalties. Penalties can come into play in certain situations if the person hasn't enrolled when they should have. So, and because of trying to keep our presentation concise, there were lots of little side roads we could have gone down, but we wanted to give you a general overview and be respectful of your time. So it's good to bring up these other little side streets and to talk about them, but if we put everything in here, we'd have been here for days. So you had a question?
Yeah, I was just going to say, I don't think I have a question, but they were talking about the Part B, and they was talking about if they have a company, they work for a company, and the company covered them, they could refuse Part B. And that scenario is saying is if their spouse is currently working, they can refuse Part B as well. And
Right.
then you said if a company 20 and that has 20 employees or more, it's two parts to that. But I'm gonna leave it alone.
Oh, okay.
It is. It's two parts. It's more to it just being a company with 20 people.
Okay, gotcha.
And that makes it important to talk to HR.
So the comment was that it also plays into whether you're under your spouse's coverage also. If you're 65 and your spouse is still working and you're under their coverage, you can also delay picking up Part B under their coverage. Yes? Oh, I'm sorry.
Question at Hartford Memorial.
I don't mean to be neglectful. I apologize.
What was the question?
Ma'am, I forget. Thank you.
Sorry.
If you remember, let us know.
Someone just needs to do a chicken dance on the front of the screen so that I can see you.
It's hard to see.
Okay, I do remember. If you're covered by your employer's health plan, plus you have Medicare A, does Medicare A cover things that will they pay any co-pays to things that your health insurance doesn't pay? Or do they act like a secondary, the Medicare?
Okay, so the question is asking if an individual has coverage through an employer and then has Part A, will Medicare pay the copays or cover anything for the private plan or the group plan? And they'll only cover things related to hospital, so inpatient hospital stays and things of that nature. If it's only A that you have. If you have A and B, then they'll act as a secondary to your group coverage. Does that answer your question?